Ashley, good to see you back safely. Now, you're one of the last reporters allowed into the hardest hit areas. How did your remarkable journey begin?
Well, I flew straight into Freetown and immediately left the next morning to drive 12 hours into the epicenter of Sierra Leone's Ebola outbreak, into the district of Kailan, which is a border region in the very east of the country. It's the middle of the rainy season in Sierra Leone at the moment, which means that the parts of the road that are not paved are often totally impassable. And certainly in Kailan, there are 470,000 people scattered across remote villages. It is very difficult to logistically get people and supplies, medical personnel and medical equipment around the region because it's so difficult to operate on those roads.
Was there anyone on the road checking the health and movement of people?
The government had just declared an increased state of emergency, which meant that they had deployed the military and police to various checkpoints across the country.
Well, I'm explaining today in order to come and get the preventive measures, in order to wash down with the chlorine.
Why?
I even have these little kids to come and do so, because sickness cannot pick. Either big, small, you are no. Sickness will come for any person whatsoever. So that's why I've ordered them to come and do it.
Halfway through our drive to Kailan, we stopped at Kenema, which is another big Sierra Leonean town, and the site of the Kenema Government Hospital, which was one of the first hospitals to start taking Ebola patients because it was formerly a center for Lassa fever, which is also a very deadly disease. MSF and the Red Cross tell me that that hospital is a death trap. I went there to see what it was like, and it was chaotic, to say the least. I wandered in, nobody checked me at all. Patients are potentially wandering in and out. There is a dirty screening tent on the right-hand side as soon as you come in, where nurses in degrees of personal protective but inadequate personal protective equipment are interviewing potential Ebola patients, sick patients, about their symptoms.
We are doing a screening. We are doing screening, taking patients' histories, past, present histories. If they are before into Ebola, we send them into Ebola ward, because some cases, signs and symptoms of Ebola. Headache, yes, vomiting, diarrhea, at least we send you to Ebola ward.
You have no idea whether the people that you are coming into contact with there have Ebola. When I arrived, I overheard a doctor in the background tell me, "Don't touch the walls." The place is potentially completely contaminated, and yet at the same time there's a maternity ward. They're trying to treat malaria, they're trying to treat typhoid, as well as having this Ebola isolation unit there. How many patients are in the hospital now?
Here, now, plenty. I can't record them now.
Do they have Ebola?
Yeah, some are getting Ebola, some are not. We have some of them, but they have admitted them today.
I understand that some nurses have died here.
Yes.
Can you tell me how many?
Well, we are now close to 20.
You simply cannot have people wandering in and out with potential Ebola symptoms at the same time as patients who might not have Ebola at all. And I got the impression that the nurse just didn't really know what she was doing.
It's a dramatic death toll amongst the nursing staff. If they're struggling, it's hard to imagine the situation for the villagers. How do they get information about this disease?
There are teams, local teams of volunteers who are going out into the rural communities and telling people about symptoms, telling people how to prevent the disease, and telling people what to do if they believe themselves or a relative may have contracted Ebola.
We have these charts which we usually display to the people. You see, telling them what to do and what not to do. You see. Now, like this one, we get the other infection through somebody who is being affected. Like if I'm affected, if I touch the person, if somebody touch me, then the disease will be affecting him too. So we're coming to this next house.
The problem is that this is a vast area with a very large and dispersed population, and there are simply not enough people on the ground who are trained to be able to cover the population and genuinely educate people, help people to understand in their own local context what this disease is and how to prevent it.
Now, I understand that funerals are a risk for everyone concerned. Why is that?
Ebola is transmitted by physical contact with an infected person, and a deceased person, somebody who has died from Ebola, is at their most contagious immediately after death. I went out with the Red Cross Dead Body Management team, who are deployed to local communities whenever a death in the community is reported. The government has ordered that all deaths in the communities need to be reported, at which point the dead body management team are deployed to safely deal with that dead body. They have to bury it in the correct, disinfected, safe way, and they must swab the body, because it is impossible to tell whether somebody has died of Ebola just by looking at them.
Many people in field say, would still pay the same respect, the last respect to the loved one where you don't go. Okay? Whatsoever procedure say we can do. So then the only difference now, because we no go wash them like they can wash them normally. Okay? Mm-hmm.
The dead body management team made a very big show of dressing up openly in their personal protective outfits so that everybody could see what was going on. As you can see, they've dressed me in some protective gear to be able to stand outside the house and film the process of them going inside and collecting the body. They then went inside, dealt with the body and brought the body out. It was a very distressing thing to see. The relatives the emotion was raw amongst the relatives who were right there watching the dead body management team extract the corpse of their relative and bring it out into the front compound.
Is it always a big gathering like this? Does the whole village always come out to see?
Always.
Okay.
Always people come out to rally to exactly see what we are doing and how we are doing it.
Yeah.
Because the perception used to be different.
Okay.
They were claiming that when this exercise is being done, they take some parts from the corpse, either to do some prayers or to do rituals. So this is why now we open the window wide, the door is wide open, you can stand at far and see what is happening inside.
When you turn up in a village, you go to a village to do a burial, and people are angry with you or they're afraid, how does that make you feel?
Well, I will feel uncomfortable because while I'm doing the right thing, people are trying to neglect my efforts, so I will feel discomfortable. Yes, even as I'm speaking to you, where I'm staying in my communities, people are afraid of me when they hear that I'm working with the dead body management, DMT. So they are afraid of me, so we cannot eat, we cannot share eating together.
Well, this was obviously a dangerous assignment. There are very few journalists reporting from there. Did you feel at any point that you may be exposed to the disease?
I never felt that I was at risk of physical harm, certainly not. There was no risk of public disorder. But there's no doubt that the paranoia that comes over you when you realize you are in the middle of a serious disease outbreak, you cannot see it coming. It makes you distrust people. It makes you so aware of everything that you are touching. every footstep that you take, every person who is near you. And that gave me a bit of a sense of what the local people are feeling, to be told that they are living in the midst of this highly deadly virus and not knowing where it's coming from and how it can be contracted.
This sickness is a killer disease. It can kill all of your families. We are totally afraid. See, that is the main point.
Did you get any sense of order at all? Is anyone taking control of the situation, or at least trying to?
Médecins Sans Frontières, or Doctors Without Borders, are the experts in the field out there. They have established in June the biggest ever Ebola treatment centre. It's an 80-patient treatment facility outside Kailaun town centre. It feels extremely well ordered, and the planning that's gone into the construction of the place, which was only established in June, has been absolutely meticulous.
It must have been an eerie feeling to be just 2 meters from somebody infected with this horrible disease. What did you feel when you were talking to the patients?
It's an unnerving feeling to stare into the eyes of somebody who you know is sick with Ebola. You are divided by a plastic fence. They are in the high-risk zone and you're in the low-risk zone. But because Ebola is transmitted by very close contact with an infected person, physical contact and the sharing of bodily fluids, it is safe to be able to talk to somebody like that. And I met patients who were feeling okay. They were feeling strong. They had been there a couple of weeks and they were, I hope, on the mend.
Dancing.
It's good.
Dance, yeah,
It's good to dance. When you dance, you get stronger.
Yeah.
I met a young mother called Hawa Idrissa, who was extremely feisty.
I will not feel happy because I want to go home to my daughter. I want to see her now.
How old is your daughter?
1 year.
But she's okay, no Ebola.
Yeah, no Ebola. No more Ebola. Only how I have Ebola.
I left my number with Hawa, and the day before I left, she called me herself to tell me that she'd been discharged and she'd gone back to her village. It was fantastic to hear that news.
Step by step, very slowly getting back to talking with friends.
There's an Australian psychologist working out there called Malcolm Hugo from Adelaide, and he is the main MSF psychologist counselling people who are operating or sick in the treatment facility.
As you can imagine, they're in a pretty terrifying situation. They're in a life-threatening situation, and they're surrounded by a death and a lot of suffering. So there's obviously some psychological effects.
He introduced me to a young lad of 18 who was one of the survivors, a chap called Lahai, who was extremely relieved to be going home finally. And how many family members? You have mom, you have dad?
My father and my mother, they are there.
They are waiting for you?
No.
What will you say to them when you see them?
I'm going to teach them about Ebola.
You're going
how to prevent themselves.
You're lucky.
Yeah.
You're strong.
Yeah, I'm very strong.
I witnessed a discharge counselling session between Malcolm and Lahai, and then I accompanied Lahai back to his village to meet his mother. Lahai was extremely proud of the certificate of negative status that he'd been given, which is issued by MSF for every survivor, because it's very important for local communities in order to be able to accept the infected person back into the community. They need proof that that person is no longer contagious.
No more Ebola.
And we had to do this to prove to them that it was okay and that the person could be brought back into the community safely.
Ashley, well done on an assignment that not too many would be keen to undertake.